Technology has a role in modern orthopedics, as I think anyone would probably say, in foot and ankle reconstructive surgery and trauma. That role is sometimes not well established. I think it's well established in the fields of sports medicine. MRI technology is commonplace, commonly utilized, and generally understood. This is a good example of the use of technology in modern post-traumatic orthopedic care, or we call cold trauma care. This is a case of a gentleman who suffered what's called a Tailless fracture, also known as the astragalus bone. The talus is a very important bone in the foot and ankle. It's the top of the ankle joint, and as it extends down, it's the first bone of the foot. It's the link between the commonly known motion of the ankle, which is flexion, extension, or up and down, and the foot, which functions in side-to-side motion and shock absorption, and the ankle and the lower ankle joint, called the subtalar joint, linked by this bone called the talus, are that amalgamation of motion. And an injury to that bone will affect both. It'll affect your ankle and affect your foot. A fracture of this bone is very difficult to treat. This was treated expertly by a colleague, put it back together anatomically. The fracture initially, we'll typically do x-rays or a CAT scan to assess the level of injury, and if an injury is displaced in a critical bone like the talus, then typically surgery is recommended. In a case like this, though, that surgery was done, the x-rays looked absolutely fine, and yet the pain persisted. So we have a gentleman who suffered a fracture. It was very straightforward. It was a car accident. Injury was evident on x-rays and evaluated with a CAT scan, planned and executed well. In fact, the post-surgical films look good, and he continues to look good x-ray-wise, but he hurts. He can't walk. His ankle is swollen. What do? It's been a year. By all accounts, the injury should be completing. Maybe there's some deficits, some loss of motion, a little bit of stiffness, but clearly there's a problem here. The study that I recommended is called a SPECT CT scan. It's an amalgamation study of multiple different layers of studies. It's a combination of anatomy and metabolism. So the concept is that the areas that are metabolically active are typically the source of the symptoms. And when we do these amalgamation studies where we fuse or overlay studies, we can get a handle on where the metabolic activity is in conjunction with the overlay of anatomy. And this is a good example of it, where a gentleman comes in with an ankle, hind foot, the entire region is painful and swollen, no real good source of pain. We'll do what are called challenge injections. I'll inject the joints and see if we can elicit at least a temporary response. Sometimes that's helpful, sometimes it's not. Technically those can be challenging. But this is a side version, and we can scroll. And then you can clearly see, even as a non-orthopedist looking at this, that there's going to be a clear area of abnormality, and this lights up in the tibio-talar joint. The other joint that we'll typically see involved is what's called the subtalar joint, and this looks absolutely symmetric with the other joints. This is the sagittal or side projection, and there are other areas that are in different locations, and this is the front projection, and you can see the side-to-side comparison. This is a normal ankle joint, a normal subtalar joint. This subtalar joint has arthritis. There are little what are called subchondral cysts, but the ankle joint itself, you really have you can really easily see the degree of metabolic activity in that joint on both sides. And there's evidence of a little bit of collapse, which is not atypical, and so you get the anatomic detail of a CAT scan with the metabolic overlay. And I think identifying the source of pain in a case like this that is technically challenging by physical examination and by plain imaging, we do an amalgam study, and it really shows up nicely and really gives an answer to the question, and potentially now we know the source location. That really opens the door to what are the treatment options going forward.